Well, good afternoon. It's a pleasure to spend a little bit of time with you today. I know Michelle Owen couldn't make it, but I really appreciate her extending the invitation to Katie and I for Transitions to speak to you a little bit today about what we do and what we're so passionate about in our community. I think we're going to start. I'm going to show you about a 1-minute video clip to give you a little bit of an overview of Transitions, and then we'll jump right in. This will. I was working hard.
Asking for help is difficult. So we try to remove any barriers they might face.
And that's the only thing that's got to pay for the treatment.
I think our team is really special. I think our team is a beautiful combination of being exposed in the field and having passion to shoot children.
So this is a topic and you
Yeah.
could see the steps because of all that.
When talking about evidence-based, what we want to make sure is that the treatment that we provide for transitions is rooted in facts.
That's the hallmark of quality care, is to really treat everybody as an individual.
We're constantly improving things that we do, we're looking at other types of interventions. Even treatment services to the individual, what they've been through, really gives the person the greatest treatment that could be.
So that's really good transition to feel better, treat people, and help folks feel better.
An individual can then respond to a partner and say, I'm here and I'd like some help. They don't need to call, they don't need an appointment.
Asking for help is difficult. So we try to remove any barriers they might face.
And that's really includes pay for the treatment. I think our team is really special. I think our team is a beautiful combination of being exposed in the field and having passion for the individuals we serve.
Good spot for us to start, and I really just want to spend our next few minutes together talking a little bit about how we treat substance use disorder here in Northern Kentucky. I think one of the things that makes Transitions really special in the nonprofit landscape in our community is we've been around 54 years this year. And I know there are a couple of other nonprofit organizations that I can think of, Community Action Right and Center, that have also been around a long time, but I think that makes us unique. And I think one of the things that we're most proud of is that, we were founded by a group of concerned citizens in our community in 1969, and the issue was substance use. So for the last 54 years, we've changed how we do things, but we've continued to be focused on our primary mission, which is to provide drug and alcohol treatment for adults with substance use disorder in our region. So some of the points that I really want to share with you today that is really the foundation of how we do business at Transitions, and probably one of the most important things I could share with you today that we believe and that we know is that addiction is a disease. It's a chronic, progressive, if left untreated, potentially fatal disease. And I know all of you, like all of us at Transitions, have had loved ones or friends, close family members who have an experience with substance use disorder. We know that it is a brain disorder. We know that individuals, if we can get them into treatment and match that treatment intervention with where they are in the progression of their disease, we know that treatment works and that recovery is possible. It might not happen the first time in treatment. Some of you might also have that experience where you have friends and loved ones that it's been more than one treatment experience. But Katie and I can tell you that we have the privilege every day of working with 40 to 45% of our team at Transitions are in recovery. And so that would be one of the biggest things I would want to share with you. And just like any other disease does respond to treatment. So again, once we assess an individual, we have master level licensed clinicians on our team, we have a medical team, and when they meet with an individual and they do an assessment, they're looking at all aspects of an individual's life. And they are making recommendations and creating a treatment plan for that individual to give them the best opportunity to live a life of sustained recovery. So just like any other disease, we know that addiction will respond to treatment. We also know that immediate access to care is critical with this disease. About 5 years ago, we couldn't tell you that there was not a waiting list for a residential treatment bed in Northern Kentucky. I'm proud to tell you today that Katie and I have been serving on a leadership team at Transitions, and we took that very seriously. That when an individual says that they're ready for help, we as the community have to have the resources in place in order to meet that need. And we have that resource here in Northern Kentucky now. Transitions opened, we went through a major capital campaign, and we opened the residential treatment center at the end of 2018. And it has 180 beds. We serve men and women at that facility. So if someone calls today, they can come in today. We never have to say, can you call back next week? We don't have a bed for you. And so that's a very important gap that we filled in our community to be able to say that for individuals and for decision makers and caregivers of a loved one who has this disease. The other thing I'll tell you is that everyone we treat is an individual. So just like if a person would have diabetes or any other medical condition, your medication, your exercise, your diet, all of those things make you a unique individual, and your treatment will be individualized because of that. We see addiction medicine the same way. So everybody that comes in is treated a little bit differently, and their treatment plan looks a little bit differently based on what their unique circumstances are and the disease that they have and the progression of that disease. One of the things they shared in my bio is that I'm pretty passionate about addressing stigma in our community. Addiction is a disease, and so I think there are a lot of times that people see it as a moral failure or criminalization of it. And what we know is that when there is a lot of stigma around the disease of addiction, it keeps people from seeking help because there's a lot of shame and guilt. So what we're trying to do is, by talking to different groups, is really normalizing the conversation, not only about substance use disorder, but also about mental health, so that people in our community, people in our families who are struggling with it will be more willing to come in and receive some help. You will also hear us say a lot around Transitions that language matters. So we're very intentional in the words that we use to describe individuals with a substance use disorder. We use person-centered language. The disease does not define them as an individual. You will hear me say things like a person with a substance use disorder, an individual in recovery, a person with the disease of addiction. So it doesn't define who they are. You will not hear me use words like addict or junkie or alcoholic, or a person being clean, or a person being dirty. We don't use that language. It's stigmatizing language to us. And so we're really intentionally trying to change the landscape about how people view substance use disorder. And the final thing is that recovery is possible. Transitions has worked for a long time in our community, treating individuals with substance use disorder. We see many success stories. And so we want to make sure that people know in our community that we are there as a resource, that hope is alive and well, that we're doing a lot of great work in our community, and that you can feel confident making a referral to Transitions because we are accredited, we are licensed, we have qualified team members providing those treatment interventions to help individuals move to the next phase of their journey. And I do want to just make sure that I let you know we are nationally accredited by a couple of different organizations, and that's important. Every 3 years, the Commission on the Accreditation of Rehabilitation Facilities comes into Transitions, and they look at everything that we're doing. They look at our client files, they talk to clients, they talk to staff members. They're looking at our electronic health records. They're looking at treatment plans. They are looking at our financial policies. They are really looking at everything about transitions. And every 3 years, we go through that process to keep that accreditation and to make sure that we are providing the highest quality of care to an individual with a substance use disorder that we possibly can. You know, I think the big thing that we do is really help individuals jumpstart their recovery. And so that looks a little bit different based on an individual's use, their family dynamic, if they're involved in the criminal justice system. But really what we're doing as a team at Transitions is providing treatment interventions and different types of planning to help an individual be successful in their recovery. For some people, that means that they come into our residential treatment program. For other people, it might mean that they're in our intensive outpatient program. For some people, they might be able to go back home once they've completed treatment because home is a safe place. For many people that we serve, we need to provide recovery housing or sober living because they've done all this work in residential treatment, but then they don't have a safe place to go back to. So we look at everybody and we provide a lot of different services in the continuum of care in order to help people move forward. You know, like every nonprofit organization, we have a mission statement that really guides how we do things. But the main thing is that we want people to live healthy, productive lives, just like you want for your loved ones who might have a substance use disorder. So everything that we're doing is really to that end. We want people to have meaningful employment. We want them to have stable housing. We want them to be working their recovery program. We want them to build a community of people in recovery. We want them to be able to change the hard things that they have to change in their life. And some of that is their closest relationships. And so they're doing the hard work so that they too can move forward and have a meaningful and healthy life. Our vision is really to be the leading agency for treatment and recovery services, not because we're interested in being better than anybody else, but it keeps us focused and our eyes kind of moving forward. And it keeps us always looking at how can we do things better? How can we do client care better? How can we decrease the number of people that leave against staff advice? How can we get better at providing the care and the services that we provide in order for an individual to be in recovery? Like all of you in your places of business and work, we have core values. We know, out of all of these, I would just call out a couple, that recovery is possible with treatment. We know that everybody's recovery journey looks a little bit different, and we value and support that person, each person's recovery journey. Our staff and our alumni are critical to the treatment and the care that we're providing at Transitions. We're not making anything. Our people on our team are the people providing the service. So we value and support all the diversity that comes from our team. I stated it earlier, we have about 40 or 45% of our employees that are in recovery. And if you're an employer and you'd like to talk to us a little bit more about how that works as an employee or maybe being a second chance employer, we would love to have that conversation with you as well. This is just an overview of some of the services that we provide. I think a lot of times people are really curious about what does residential drug and alcohol treatment look like. We have two beautiful facilities, and I'll show you some pictures of them here in a few minutes. But we have two beautiful facilities, and they have a little bit different model, but everybody typically begins in our triage unit. We have a clinical nurse manager and a nursing team on our staff. We also have master level licensed clinicians, and everybody starts in triage. Everybody starts with an assessment. So it's really important for us to recruit and retain qualified staff in order to provide an accurate assessment so we know what's going on with the individual, so we can develop the best treatment plan for them and give them the best opportunity for recovery. So everybody starts in triage. We do, all the kind of baseline medical things, making sure they're medically stable to be there and then clinically appropriate to be there. Residential treatment happens at two of our big facilities, the residential treatment facility or the Grateful Life facility. And basically, residential treatment looks like group meetings with our licensed clinicians. It looks like individual meetings. We do family therapy. And then we also have other types of education groups that people on our team facilitate those. So it's really spending a lot of time with the individual and educating them about the disease, about the genetic component of substance use disorder and the fact that it is a disease, and helping equip them with all of that knowledge and those tools, helping them develop a relapse prevention plan when they're ready to transition to that next level of care or they're ready to leave residential treatment. So our team is working in a variety of ways during a residential treatment stay in order to provide the person all the tools that they need. We typically see intensive outpatient treatment as that next step down in the continuum of care or a lower level of care. So I was speaking to someone earlier about if you have a knee replacement surgery, your knee replacement surgery is going to be really successful and help you. That's, that intensity of residential treatment is it's going to give you a lot of tools, but we regularly refer people to intensive outpatient. Just like your physician, if you've had a knee replacement, is going to refer you to physical therapy, right? So you're going to have better mobility. You're going to be more successful in getting the use and function of your knee back if you do all of the therapy, and it gradually decreases over time. So that's very much how we see addiction, and that gradual decrease of intervention for clinical services. Some other things that we do really to support individuals, targeted case management is really services. We have case managers that work in the community with individuals to help them eliminate barriers to what's next. So we're helping people get birth certificates. We're helping people get driver's license. We're helping people set up transportation. We're helping people find jobs. We're helping people set up a budget. So we are doing a lot of different services through targeted case management. But the overall goal of case management is to really eliminate barriers for them re-entering into the community, being productive members of our community. Recovery housing, you might hear, you'll hear us talk about recovery housing. A lot of people use the term sober living. We really focus on the recovery word. So several years ago, we identified a need from the individuals that were completing our treatment that we needed to expand housing. We wanted people to have a safe, affordable, supported place to move into. We didn't want them to do all this work in treatment and then not have a safe place to go back to. So we started to expand our recovery houses. We continue to own and operate those. Most of those are in Covington. We also support individuals who have an opiate use disorder and their physician might prescribe medication to help with their opiate use disorder. So there are several FDA approved medications and we are supporters of that as well. And then I think one of the things that I hope you guys will grab a business card and call me and tell me you'd love to bring your team or you'd love to come for a tour. But one of the things that makes the residential treatment center so special is we have on-site health clinic and an on-site dental clinic. And so what we knew is that when individuals come into residential treatment, many times other kinds of health concerns have not been taken care of while they've been active in the disease of addiction, right? So they haven't taken care of their high blood sugar or their high cholesterol or those kinds of things. And they also have teeth that are really causing them a lot of pain and giving them a lot of trouble. And as soon as that pain starts to set in their first few days in treatment and they're ready to leave. And so we tried to figure out a way as an organization that we could bring more holistic services under one roof. So it keeps the person engaged in treatment. They're not having to leave for several hours to go out. It lets us keep our staff in the building because when they were leaving to go to doctor's appointments, we had to send staff members with them. And really the individual is getting treated as a whole person. So all of those things, we can get people started on medications. We can get fillings done. We can have teeth pulled. We do a variety of different things through our dental clinic. The other thing that's pretty special about both of those clinics is that we partner with HealthPoint Family Care. So if you're familiar with HealthPoint, they have been just a great partner. They do health services, they do dental services. We don't do that. So we provide drug and alcohol treatment, they provide medical services. And so it's been a really great partnership for us all to be under the same roof. So anybody that's in either one of our treatment programs has access to the medical and dental services on site with HealthPoint. And what that also does is get them established with the primary care provider. So when they're leaving treatment, they have a doctor, they have a dentist, and any of that follow-up care they can take care of and we can help them get scheduled. This is Annabelle. Annabelle is a pet therapy dog. She belongs to one of our clinicians. So in addition to all the group and individual counseling that we're doing, we do some other things. We bring CrossFit and yoga in. We have pet therapy. we bring recovery meetings in every night into our treatment centers, either AA or NA facilitators come in to facilitate groups to get them exposed to that kind of community. So when they're leaving, they have a community established and they know some people. But Annabelle belongs to Joseph, one of our clinicians, and Annabelle has been coming there since she was a baby. And she's everybody's favorite. She won Employee of the Month in March. And she has her own ID badge. And she adds so much value, it's hard to explain in words. I would love for you to come and just see her walk around. But one of the things that she does so well, you guys can imagine when somebody comes in and they're sitting in the waiting room, how hard of a decision that is, right? To say, I need help, things are not going well in my life. And Annabelle walks around in the front lobby and she goes up and she greets people as they're sitting down and they're waiting for their electronic health record to be created and to sign their releases of information and all of those different kinds of things. And to see someone's anxiety just visibly decrease because Annabelle has come up and they put their hand out on her head and she just really engages them. We also see her doing a lot of great work in our group therapy when they're talking about tough conversations and it might be focused around trauma. Annabelle has a way of giving somebody something to do with their hands while they're talking about things that are hard to talk about. And so she adds so much value. We are all pretty crazy about her. There are lots of staff who might have special treats in their offices, but she comes around for a visit. But you'll get to see Annabelle if you ever come. So again, a few extra things about us. We believe in the disease model. It is a chronic, progressive, potentially fatal disease. We know that it is treatable. We look at everything through a trauma-informed lens, which basically means when we're talking to an individual who's in one of our programs, it's not what's wrong with you. That's not the question we ask. It's what happened. What happened that you got here? You're at this point, and how can we wrap services and treatment around you to help you get on a recovery journey? Person-centered, we talked, everybody's an individual, and recovery focused. We want people to re-enter into our community. We want them to have meaningful employment. We know that meaningful employment is very important to an individual in early recovery. It's good for their self-esteem. It's all good for them. And then their goals for treatment really are stabilization, understanding of the disease, having a plan for employment, having a plan for housing, and really, having a relapse prevention plan and having a community that can support them on this journey. Sometimes people don't come from healthy families or healthy environments, and helping them build a new community is a very important part of the process. This is the residential treatment center. I know some of you guys have been there. I see a lot of familiar faces in the audience, but this is the residential treatment center. This is a 180 bed facility. So we intentionally overbuilt it. And we did that on purpose because we wanted to be able to say, if you need a bed, there's a bed in our community. Walk-in hours, you don't have to have an appointment. Monday through Friday, 8 to 7. On Saturday, if we need to. We have a medical director, a psychiatrist, we have clinical nursing staff on our team. We have clinicians, we have, all kinds of great services that we provide at the residential treatment center. This is the Grateful Life Center. Some of you guys, if you've been in Northern Kentucky for a while, are familiar with Grateful Life. It has been around about 15 years. Grateful Life was established by Governor Fletcher. They put 2 Recovery Kentucky facilities in each area development district about 15 years ago. Transitions has owned and operated the Grateful Life Center for men. It's a 110 bed facility for men. Brighton Center operates Brighton Recovery, and they operate the counterpart for women in our community. So we have a great relationship that we work with Brighton Recovery as well. It's a little bit different model. It's more peer driven, peer accountability. Great facility. About 60% of the referrals that come to the Grateful Life Center come through the Department of Corrections. That's a little bit of an overview there. And then just again, our recovery housing program, we want people to have a safe and supportive place to transition back to once they've done all this work in treatment. And this is a picture of some of our houses. We have about 53 beds. We're in the process of opening a new apartment building with 11 efficiency units. That'll be happening in the next couple of weeks. We have a couple of houses up here that are specific for moms and children. So we do allow moms with children to come into treatment, and we do allow moms with children to be in our housing. We have a couple of houses specific to that. Questions do you have for me about substance use or about transitions in particular? I would love to answer some. And Peter is our board member. Sorry, Peter, I should say that.
I feel ashamed that I didn't invite you out sooner. So. One of our meetings, I'm pretty sure I heard Jim say that even though drug abuse is a serious problem, but there's still many more people dying of alcoholism than drug.
Yes, I will tell you that I don't have the specifics off the top of my head, but the population that we serve, they're typically polysubstance users. So it's very rare that someone would come in and just at their baseline urine history test positive for one substance. Many of them are tested positive for 2 or more substances. Alcohol might be the exception to that. We do have people who come in and they have an alcohol use disorder. But many times people are, it's both illicit substances, drugs, and alcohol.
Are you all bound by the HIPAA law?
Yes, sir. Yes, sir.
What's the occupation at Mary Travis? So, I'm sorry, how many folks were in there?
180 beds.
It's a 180 bed facility, so we could serve that many, right? Anywhere typically, right? I think in this summer, we've seen anywhere between 50 and 60 people
Okay.
in treatment. Across the road at Grateful Life, it's a 110 bed facility, and I feel like it's around 80 or 85 right now. I will say that we never closed our doors at any of our treatment facilities during COVID because we knew that, one of the things we know about addiction is that it thrives in isolation, where recovery thrives in community. Community is good for all of us, we know that. So we did see during COVID, our pre-COVID numbers, Grateful Life was probably right at 110, and the residential treatment center was right between 95 and 100 individuals in treatment. So we have not seen that directly come back yet, but we are seeing our numbers gradually increase. So we're hoping, and this is part of, what my job is to make sure we're going out in the community and making sure that people are aware of our services and that we do have a bed available.
Is there any long-term idea of how to keep people there? When they come, they really want to stay. You have to answer to leave, and it's, you can get up and go out of any of these centers. Is there any solution to that?
I would tell you if Jim is our CEO, if he were here, he would probably be able to speak more eloquently to your question, but we see a lot of people that it takes them multiple visits into the treatment center and treatment experiences before they actually begin that and sustain that recovery journey. Everybody is unique. We certainly have people who that is not the case. Part of our responsibility at Transitions is to engage individuals early on into treatment, get them connected to other people in treatment, make sure we have staff that are engaging them, all in hopes that they will stay. The longer that they stay, the more we know that they're going to learn and they're going to be more likely to, live in recovery. But yes, certainly there are people that come in and they say, I don't want to be here. I'm going to leave. I thought I wanted to do this. I don't want to do it. And so Transitions, they might have consequences from that. And our team is really good at explaining what those consequences may be. Certainly we have many people who are self-referred, so they wouldn't necessarily have any other consequences. But yes, there are people that choose to leave. We do everything we can to agree that.
Brad, what else is a nonprofit? What's the other top 2 sources of revenue to keep your going?
Yeah, that's a great question. So we are a fee-for-service organization, so we do build insurance for the services that we provide. We do also accept donations, but typically donations and grant funding that we seek is typically to help us do special capital projects and renovations to things like that. But the majority of our revenue is a fee-for-service revenue.
That question right here.
What's the average length of stay when someone does come in? How long do you usually the average stay is?
So it depends. Everybody's an individual, but typically at the residential treatment center, people will stay anywhere from 28 to 45 days, depending on what they have going on. one of Katie's responsibilities, in addition to accounting and human resources, is she's also responsible for our authorization team. So we have people on our team who are constantly, talking to the insurance companies and things like that. But it's an average of 28 to 45 days. At the Grateful Life Center, we have a program that's us. We are only adults at this time. You have to be 18 to come into any of our programs. 18 and above.
So just a little clarification to me, I have facility on 3 Ohio, but your relationship with the Grateful Life is,
We're the owner and operator of it.
oh, okay. But the referrals there are mostly through the court system.
They do. A lot of the way that the Recovery Kentucky model was set up originally was a partnership with the Department of Corrections. So yes, about 60% of the referrals for Grateful Life come through the Department of Corrections.
And then can I assume that's not optional for them to leave?
I think people can leave. It just there could be consequences if they leave.
Okay. As you know, they leave.
Yeah, they do, unfortunately, and our team works really hard and make sure that we explain what those consequences could be, but at the end of the day, yes, it's a choice for them to say.
Yeah, I feel bad for them, actually, they have their bag of clothes on their back and they're walking down the highway somewhere. It's kind of sad if you can walk away from that.
Yeah, it's a great opportunity and we have great facilities, and so ultimately, we want people to stay, our team has to engage and do everything that we can possibly do to avoid that outcome. And we certainly, we're in the business of second, third, and fourth chances, right? So people might come through the first time and for some reason they weren't ready, it didn't work, whatever happened. Sometimes they're still really focused on what's going on outside instead of being able to really make that turn to say, what can I work on while I'm here? This is a great opportunity. And sometimes that's part of the journey. But we always welcome people back to say, we're glad you're back. We're glad that you're here. We don't believe in providing, shame and guilt for people to say, man, it didn't go right the first time. We're just glad you're back. And how can we help you this time? And what do we maybe need to consider that we didn't consider last time?
Thank you very much.